Radiotherapy is one of the tools that we have that we can use to treat cancer. It's very targeted, very highly technical, very precise, and we use it to destroy cancer cells. It's very, very effective, and it does have some short-term side effects. In some instances, people do find that they can experience either long-term side effects from their radiotherapy that don't really settle in the weeks and months after their treatment, or late effects which can occur anything from months to many, many years after their radiotherapy treatment. And these can have a significant impact on people's ability to carry out their normal day-to-day lives. Late effects of radiotherapy will be specific to the area of the body that was previously treated. An example of somebody who's had a tumour within their pelvis treated might be somebody who's had prostate cancer. So just because of our anatomy and where the prostate sits, it means that despite the treatment being really accurate and really specific, the bladder and the rectum can get irritated. So in the future, you might find that you experience continence concerns, so you might have real urgency and frequency with passing water, and you might find that your bowel function changes so that your bowel movements might be a lot more frequent, they might be looser. In other cases, for people who've had breast cancer treatment, the late effects they might experience would be very, very different. So they might be changes to the breast tissue itself, so that breast tissue could shrink slightly. They might get some pain, some tenderness. There might be changes to the skin. Patients who've had radiotherapy for cancers of the head and neck area can also experience long-term and late effects that can have quite a significant impact on their quality of life. And that can include things like dry mouth, difficulty swallowing, reduced jaw function, so opening, how far they can open their mouth. And also they can find that the skin and muscles around their neck and shoulders can tighten. So some patients find they can't turn the head maybe as well as they could do prior to having their treatments. But late effects are very specific to the area of the body that we've treated. I think it's really important to understand that we want people to come forward and be referred into our service, because we do know that there are potentially lots of people in the same situation, and it's important not to feel alone. So you can refer in yourself. So the contact details are all on our website, and all GP practices have got information about the radiotherapy late effects service. So your healthcare professional, your GP, can refer you in, and they can do that either by contacting the service by email or using their electronic referral service.